Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. The carpal bones, which are short bone. The carpus is the anatomical term for the wrist which connects the radius and ulna of the forearm with the metacarpal bones of the hand. It is comprised of 8 individual carpal bones that are seated in 2 neat rows of 4. The proximal row of carpal bone as seen in a lateral to medial direction on the palmar surface include the scaphoid bone, the lunate bone, the triquetral bone and the pisiform bone. The distal row as seen from the same viewpoint as above includes the trapezium bone, the trapezoid bone, the capitate bone and the hamate bone. The scaphoid bone. The scaphoid bone is the largest carpal bone of the proximal row and it lies beneath the anatomical snuff box. Relation: superficially anatomical snuff box, proximally radius, disto-laterally trapezium, disto-medially trapezoid, superomedially lunate and inferomedially capitate. The lunate bone. The next 2 proximal carpal bones, namely the lunate bone and the triquetral bone, which articulate with the head of the radius, which is known as the carpal articular surface. Relation: laterally scaphoid, medially triquetrum, inferiorly capitate. The triquetral bone. The triquetral bone is shaped like a pyramid and from a palmar perspective, its apex point disto-medially towards the pisiform bone, which is positioned upon its palmar facet. Relation: disto-medially pisiform, inferiorly hamate, laterally lunate. Pisiform bone. Lastly, the pisiform bone is the most medial proximal carpal bone from a palmar stance. It is also the smallest of all the carpal bones and classified as a sesamoid bone. Relation: dorsally triquetrum lies within the tendon of flexor carpi ulnaris. Trapezium. The trapezium is the first and most lateral of the distal row of carpal bones when the hand is viewed from its palmar surface. Relation: medially trapezoid, superiorly scaphoid, inferolaterally first metacarpal, inferomedially second metacarpal. Trapezoid bone. The trapezoid bone may look very small in comparison to other bones from the palmar aspect. However, it is much wider on its dorsal side. Relation: proximally scaphoid bone, laterally trapezium, medially capitate, distally second metacarpal. Capitate bone. The capitate bone is the largest of all the carpal bones, both proximally and distally. Relation: proximally lunate, distally third metacarpal, laterally trapezoid, medially hamate bone. The last of 8 carpal bones and the distal row is the hamate bone. It is palpable due to the hamulus. Clinical aspects. Scaphoid bone fracture. The most common fracture that ails one of the carpal bone is that of the scaphoid bone. It is most likely to sustain an injury during a fall where the person lands on their wrist when it is outstretched and trying to prevent the incident. When the wrist is extended, the center of the bone fractures and clinical symptoms include pain and swelling in the region known as the anatomical snuff box. Carpal tunnel syndrome. Carpal tunnel syndrome is the infamous term for a condition known as median nerve compression, and it is the most common form of compression-related neuropathy. It is primarily caused by occupational tendencies such as repeated wrist flexion and extension, leading to the overuse of anatomical structures that directly work during these movements. As a result, an increase in the content mass and pressure within the carpal tunnel push down upon the median nerve, leading to the sensory disturbances within its areas of innervation. Thank you. Have a nice day.